Please, shall we start?
Can hear, sir. We can hear and we can see the screen as well.
Can you hear me? And
Yes,
I shared the screen.
yes, we can see.
Okay. So without wasting that much of time, we'll start. Okay, this is the third pre-session. So we are going to do 5 true and false questions and 3 single best answer questions as the final and the third pre-session. So hopefully we are going to start our course from next week onwards. So we'll do the these MCQ first, then we'll discuss about the exam paper and the new modern type of questions, how you get the questions, what are the syllabus and what areas you should cover without going through whole ordinary forensic. You should go behind the new theory and the new model questions. So the first question, first 5 are the true and false type. The first one, true false regarding mass disaster management. And I gave the short note. You can go to the short note and there are some additional notes regarding these relevant MCQs. So you can go through those things when I am discussing these MCQs. So the first one, true false regarding mass disaster management. Disaster victim identification commence at the scene. Yes, that's true. Disaster mean it can be a natural one or it can be a man-made one, natural disaster such as earthslip or any tsunami, flood, that kind of thing. Or man-made means it can be a bomb blast, it can be a road traffic accident. So as a accident service medical officer, as a surgical intern, surgical doctor, sometimes you have to attend those disaster places where the disaster was happened. So disaster victim identification commences at the scene. Yes, that's true. Separating life from the death is the most critical factor. Yes, that's the most critical one. You have to not separate, you have to identify the live, and as soon as you have to send them to the hospital rather than sending all the bodies you are found in the disaster mass disaster premises. Sending all the bodies, that is not the correct one. You have to separate the live, and live should be categorized according to the priority and send. So number C, dead bodies should be sent to the mortuary in separate body bags. Yes, separate body bags should use for separate bodies, not all the parts and everything put into a single bag and sent. That's not the correct way. D, body part found in mass disaster should be put into the same bag with the nearest body. That's false. If there's a body or part of a body and there's another, let's say, lower limb or upper limb or a part of upper limb you found, you have to send it in a separate bag, not with the nearest body. That's false. Mass burial is committed against human rights. You can let's talk about something about the COVID pandemic. So there's a huge controversial things about burial, and some religious issues came out with that cremation of the bodies. So what are the 2 things you can do? You can either burial, you can either cremate the body. So mass burial is committed against human rights. That's false. If there are unidentified bodies, you can bury them by keeping tag or something in the body, and you have to mark that specific burial area with this tag number. Body was buried in this area. So when the later in the future, the relations or whatever the relations comes and said that this body is this photo is my relation who is dead in this mass disaster. So when that people comes, you can exhumate the body and do the DNA test and find out whether this is the relation, correct relations or not. So mass burial is committed against human rights. That's wrong, false. Number 2, true or false regarding medical legal framework in Sri Lanka. Patient admitted with injuries need to be notified to the police. Usually, yes. Not all the injuries, but when it comes to this question, patient admitted with injuries need to be notified to the police. Yes. As a intern at the surgical ward, there's a patient comes with cut injury to the forearm. So you have to inform to the police. Even though the patient says this is happened by myself and blah, 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 but I think better to inform the police. So this patient admitted with injuries needed to be notified to the police. Yes, true. B, police can conduct an inquest. That's wrong. You can go to the short notes where the I have given a small paragraph about the inquest system in Sri Lanka. Inquest conduct by inquiry of sudden death, coroner, or a magistrate. Police can support the conduct inquest, but they can't conduct an inquest. So that's false. Inquiry of death can summon a doctor. Yes, he has the magistrate powers. For fact finding, he can't give a penalty or something, but inquiry of death can summon a doctor. Inquiry of death, coroner. හදිසි මරණ පරීක්ෂක කියන කෙනාට can summon a doctor. Yes, that's true. Okay. Consent for medical legal autopsy should be obtained from the next of kin. D, consent for medical legal autopsy should be taken from next of kin. That's false. There are two types of autopsies, medical legal autopsy and the pathological autopsy. For the medical legal autopsy, it's an order given by the inquiry of sudden death, coroner, or magistrate. So it's an order, no need the consent from the next of kin. But for the pathological autopsy, not for the medical legal autopsy, pathological autopsy, yes, consent must taken, right? So this answer D is wrong. No need of consent from next of kin for medical legal autopsy. E, consent not needed for medical legal examination of a drunken driver. False. You should take the witness consent from a drunken driver person. If you can go to the guideline, which is provided by the Ministry of Health for the examination of a drunken driver person by a government medical officer, you can download it from the Google internet, or in my first session inside the short notes, I have put that first page of the guideline. There's a part to take the written consent, and there's a part for the witness. Okay, so this is wrong. The patient can say no for the medical legal examination. In medical legal, Motor Traffic Act, there's one statement: if you are a drunk suspect of a drunken driver, you are not allowed to do the breathalyzer test, and if you are not giving consent for the examination by a medical officer, you are supposed to be charged as a drunken driver. There's that kind of statement. In our theory class, we are going to discuss about the little bit about the medical this Motor Traffic Act. So from there, we are going to discuss them. Number 3, injuries seen in a pedestrian impact with the vehicle. You can go to the short notes. There's one picture regarding the injury patterns. And in our theory class, we are going to discuss about those pedestrian injuries, driver injuries, pillion rider, bike rider, and the passenger injuries. So in this, you can see mainly pedestrian injuries are categorized into mainly 3 parts, 4 parts: primary impact, secondary impact, secondary injuries, tertiary injuries. So what is answer A, linear cut on face due to falling on the bonnet. Usually falling on the bonnet means you don't get those cut injuries, you get blunt injuries. So this is wrong. If you can go to that short note and find out what is primary impact. Primary impact usually because of the buffer of the vehicle, the shell of the vehicle, front grille of the vehicle, you get primary impact injuries. Those are usually at the knee joint level, upper tibia, and the lower femur level, lower thigh level. Those are the areas where you get primary impact injuries. So primary hit on the knee joint area, then primary impact, then secondary impact is you are falling onto the bonnet of the vehicle or the windscreen of the vehicle. So you usually get hit on the head and the chest. So those are the secondary impact injuries. What are secondary injuries? Once you hit on the bonnet or the windscreen, then you are fallen onto the ground. So you get graze abrasions and hit on a lamppost or the road or somewhere, that called secondary injuries. Then there can be run-over injuries by the same vehicle or another vehicle. Those are called tertiary injuries. So the linear cut on the face due to falling on the bonnet, it is false because falling on the bonnet means secondary impact injuries. Those are usually blunt injuries. B, DAI, diffuse axonal injury, is usually due to impact on the ground. That's usually means that's false. Diffuse axonal injury usually happen due to this falling on the bonnet or the windscreen. That is secondary impact injuries. So this is DAI means usually due to impact on the ground. Impact on the ground means that is secondary injuries. Secondary injuries are usually the injuries which happen on the graze abrasions on the bony prominence areas with the moving force. So this answer is false because DAI, diffuse axonal injury, is usually due to impact on the ground, not impact on the ground, impact on the bonnet. Okay. Any questions? If you have any questions, you can raise that and ask any questions. Interrupting me is whatever you have, you ask any question. Okay. ඉන්නවද කට්ටිය නිදිද? Anybody? If you have any question, just ask. I'm doing this without wasting that much of time. That's not mean that I'm not giving you a chance to ask questions. So you ask questions if you have any doubt. And there's a short note. So you can go to the short note and see those photos and those things. So that will be easy to understand the things which I am telling now. C, graze abrasions on the body are secondary injuries. Yes. As I mentioned you earlier, primary impact injuries, secondary impact injuries, secondary injuries. Those are usually because of the fallen onto the rough surface, road, tar surface. That's face abrasions means that's because of the tangential force with the skin, with the friction injuries. Grace abrasions occur with the rough, broad surface. So those are called grace abrasions. That's because of the secondary injuries. Primary impact, the grill or the buffer of the vehicle hit on your knee joint, upper tibia, lower femur area, then you are fallen onto the bonnet or the windscreen. That's secondary impact. Then you are fallen onto the ground or the road. That called secondary injury. So usually the secondary injuries are found on the bony prominence areas. Those are usually grace abrasions because grace abrasions occur because of the tangential force with a broad, rough surface. Okay. Any questions? Questions under number D. Imprint abrasions can occur due to being run over by a vehicle. What is imprint abrasions? Imprint abrasions occur with a perpendicular force. Grace abrasions occur with the tangential force. So imprint abrasions can occur due to being run over by the same vehicle or by another vehicle. So that's true. Okay. Wedge fracture of the tibia are due to primary impact. Yes. Tibial injury, tibial fracture is usually weak. It is wedge fracture. So can you go to the short note and find what are the types of fractures? You can get the force comes like this kind of torsion, you get spiral fractures. If it is a fallen from height, you get compression fractures. So this is a pointed in a primary impact, the buffer of the vehicle, the grill of the vehicle, shell of the vehicle comes and hit on a specific area. It's usually lower femur, knee joint, and upper tibia area. So those are usually wedge fractures. So this is correct. You can go to the short note and see. Wedge fractures of the tibia are usually due to primary impact. Yes, true. Okay. The fourth one. Medical legal autopsy. Not the pathological autopsy. This is medical legal autopsy. Inspector of police, OIC, can order an inquest. Wrong. As I mentioned earlier, coroner, ISD, inquiry of sudden death, and the magistrate can order an inquest. Police can support. Police can find the facts. Police can do the scene visit. Police can do the public inquiry, public gathering information from the public, but they cannot conduct an inquest. They can support. So that's wrong. B is done in a case of suicidal poison. Yes, there are some mandatory cases where you should do autopsy. So suicidal poisoning is one of them. You can go to the short notes. There are some list. I added that list to the short note. C, done by government doctor. That's true. Government registered medical officer or doctors who are working in a forensic department of a medical faculty, which is recognized by a UGC. So done by government doctors, not the private sector doctor, right? D, consent should be taken from relatives. That's false because for the medical legal autopsy, you don't need the consent. It's an order. It's a inquest, an order given by magistrate, ISD, or the coroner. E. Musculoskeletal dissection performed in suspected torture-related deaths. Yes, you have to do the musculoskeletal dissection because you can see underlying muscle injury, underlying fractures, underlying deep hematomas, especially in soles. The police can hit to their soles with whatever the blunt object. So you don't see superficial injuries. Only you can see the subcutaneous and deep contusions and hematomas. So musculoskeletal dissection performed in suspected torture-related deaths. That's true. Okay. Last one, number 5. True or false regarding the filling of medical legal examination form that calls MLEF. The later GST, police comes and say GST, but it is medical legal examination form, MLEF. When if you are a MOOPD in a rural area, in the night, the police comes with a drunken driver with the medical legal examination form. So you have to have an idea about the medical legal examination form. A. There's a short note regarding this MCQ also. You can go to that one. Fracture of a tooth with dental caries is not a grievous injury. That's false. Even though there are dental caries, if there's a fracture in that tooth following an assault or road traffic accident, that's considered as grievous under limb G. So that's false. B. Unconscious patients are categorized as fatal in ordinary course of nature. Unconscious patient can get tongue fall back and asphyxiation risk. Then while unconscious, sphincter tones are sphincters relax, so the food from the stomach can come to the respiratory tract and cause asphyxiation, aspiration. So there's a risk of aspiration and asphyxiation in unconscious patients. It's categorized as endangering life under limb age. It is not fatal in ordinary course of nature, right? So unconscious patients are categorized as fatal in ordinary course of nature. It's false. It's categorized under limb H as endangering the life. Why? Asphyxiation and aspiration risk. Okay. Number C. Milk tooth fracture is not considered as a grievous fracture. That's false. Even though it's a milk tooth, it categorized under grievous hurt under limb G. Okay. D. Fracture of an implanted tooth is not a grievous injury. What do you think? Fracture of an implanted tooth, not a grievous injury. False. It's also a grievous injury. Even though it is an implanted one, even though a fracture of a denture following assault or following assault, road traffic accident, fracture of a denture, that's also grievous, right? So this is false. Then dislocation of joint should be supported by a radiograph. That's true. Why? If somebody comes and tells you, let's say you are a intern house officer at somewhere in a hospital. A person comes and said you that says Gamini assaulted me, so my elbow dislocated. I relocated by myself. So can we go for put it as grievous by dislocation of the joint? can't. They can they can give false information. So if there's a X-ray or something, and the joint relocated by the doctors, you have the evidence, you have the diagnosis card, you have the X-ray, radiographs. So that's easy, and that's how you categorize the grievous under limb G if there's a dislocation of the joint. So dislocation of joint should be supported by a radiograph. Not must be. Sometimes clinically you can see dislocated joint and those things. So this is not always, but most of the time you need the radiographs. So dislocation of joint should be supported by a radiograph. That's true. Okay. These are the 5 true false type questions. We'll go to the single best answers. There are 3 questions. Any questions? If you have any question, ask before we go. We are going to the single best questions. Oh, Katinwal. Any questions? So we'll start the single best 3 questions, and after finishing these things, I'll give you some kind of rough idea about the content of your exam, the new forensic trends, and what are the things we are going to cover in our course, and what are the new type of ones. These are actually the new type of questions. No, you are not going to get those ordinary forensic things like sometimes you can, but it's very rare. You don't get those rigor mortis comments at 2 hours after death. Those kind of simple questions will not gonna ask. This is now completely different. They are going behind the more practical things. As a HO, first as a HO, you are going to be a house officer. So what are the medical legal important things house officer should know? So those are the things you will get in the questions, MCQ and the OSCE, rather than asking pure ordinary forensic subject related stuffs. They will ask these kind of things. So we'll discuss them after finishing these 3 questions. I gave you the short note, and there are some short notes related to these questions also. The first one, a 45 years old male suddenly died at workplace. The autopsy revealed yellow-red area spread at the full thickness of the left ventricular wall of the heart. Okay. Left ventricular wall thickness was 1.8 centimeter. Lung showed severe pulmonary edema. Histology of the heart shows fibroblast, macrophages, and lymphocyte infiltration, which is the immediate cause of death according to the above findings. Okay. Now, the autopsy revealed a yellow-red area with full thickness of the left ventricular wall of the heart. That means that's a kind of features of myocardial infarct. Left ventricular wall thickness was 1.8. Is it normal or hypertrophy? Left ventricular wall thickness is 1.5. That's the normal one. More than that means it's hypertrophy. So this is hypertrophy, right? Left ventricular wall 1.5. Right ventricular wall 0.5. Atria 0.3 centimeters. That's the normal range. About that means that's hypertrophy. So this is more than 1.5. This is hypertrophy. Lung showed severe pulmonary edema. That means there's a heart failure feature. That's a heart failure feature. Histology of the heart shows fibroblasts, macrophages, lymphocytes, infiltration. Okay, that is because of the inflammatory condition. That means there's a damage to the myocytes, which is the immediate cause of death according to the above finding. Ischemic heart disease. Yes. Ischemic heart disease covers a vast area. Under ischemic heart disease, that means ischemia to the heart, the myocardial infarction inside that. Atherosclerotic heart disease, that is inside that. Coronary artery thrombosis and myocardial infarction, it's also under ischemic heart disease. Atherosclerotic heart disease, coronaries blocked with atheroma without causing thrombus, there's a myocardial infarction and death. So that is also covered under ischemic heart disease. If there's a coronary artery spasm and myocardial infarction and death, that's also covers under ischemic heart disease. So ischemic heart disease is a vast topic which covers almost all the ischemia causes to the heart. Okay, heart failure. Yes, there's a heart failure. Why? Pulmonary edema is a strong evidence of heart failure. Left ventricular hypertrophy. Yes, that's also there. More than 1.5 means that's left ventricular hypertrophy. Myocardial infarction. Yes, there's a myocardial infarction features. This is yellow and red area means thyroid appearance. That's not that much of things you don't need. That is a typical myocardial infarction. Severe pulmonary edema. Yes, severe pulmonary edema is there. Lungs short, severe pulmonary edema. So which is the immediate cause of death? Immediate cause of death. These all are correct. From this is a ischemic heart disease is a vast topic. Heart failure is there, but it is a mechanism. It's not a cause. It is how the heart, ultimately heart failure and death. So that's the mechanism. Left ventricular hypertrophy. It is there, but immediate cause of death is here. You can take the myocardial infarction. So that's how the single best questions comes. They give all the correct answers, and the best one is you have to select the best one. So these all are correct, right? It's an easy question actually. Right, this one. 25 years old male drug abuser taken for medical legal examination under police restraint. Okay. He become verbally abusive and aggressive and cannot control himself. Hit a thick glass of the side wall and hit on the window bar, which is the most related clinical condition. Okay. These clinical symptoms, all this aggressive behavior, the restless behavior, aggressive, verbally abusive, those are common in all of these answers, which is neuroleptic malignant syndrome. What is that? You can go to the short note. I put some short note regarding this one. So neuroleptic malignant syndrome, it's also a life-threatening condition. It's with antipsychotic psychotic drugs, which is block the effect of dopaminergic pathway, right? It has these same symptoms. What is serotonin syndrome? It's because of the serotonin mediated drugs like MAO inhibitors, tricyclic antidepressant inhibitors. Those are right. Then what is excited delirium? Excited delirium is the condition we are mentioning all these features while restraining a person by police. If you can remember the Black Lives Matter incident happened at America, where the police officer tried to restrain a person by keeping his knee on his that patient's neck, and they arrest the person and they put him into the jail. So he died inside the jail. So all the people come around and try to find out the cause of death. The cause of death came as myocardial infarction with toxicological findings of methamphetamine and amphetamine, that means ice, narcotic positive. So that's why that other scenario, all the violent behavior of the people comes because of the cause of death. By seeing that police officer keeping his knee on his neck and violently arrest him and put into the jail, and suddenly he died. That is what happened when there's this kind of police restraint. That's a kind of exercise. And excited delirium has two phases. It has drug-induced phase and normal phase. So that person, he had the ice amphetamine at that moment, and he is aggressive. So at that moment, both catecholamines and potassium continuously rise. When they arrest that person and put him into the jail, so that means the post exercise period. So he is at a resting period where your catecholamine still goes continuously rising while the potassium comes down. Sometimes the potassium comes down as far as beyond the normal range. So that's a hypokalemic state and high catecholamine stage in a same given time. That period called post-exercise peril period, where you have the highest catecholamine in the blood and the lowest potassium. That's usually happen after police arrest the person by struggle and put him into the jail. So inside the jail, that arrhythmogenic period, he can die with a coronary artery spasm. So that's what happened in excited delirium. We will discuss this with details in our discussion, our theory class, while we are doing the course. So this is just a kind of summary. This scenario, 25 years old male, drug abuser, taken medical legal examination under police restraint. He became verbally abusive, aggressive, and cannot control himself. So this is the police restraint drug abuser, means this is excited delirium, not serotonin syndrome, neurologic malignant syndrome, or what is delirium tremors. That's because of the alcohol addiction. You get shivering, irregular heart rate, sweating, hallucination, because of the confusion usually caused by withdrawal from the alcohol. So that is not this drug poisoning. Yes, sometimes there can be drugs which cause neuro central nervous system excitatory drugs that can cause people verbally abuse, aggressive behavior. So that, but it is not this one. So the correct answer is excited delirium, right? We are going to discuss this excited delirium later in detail, so you can understand this kind of question you can get in your exam, because as a surgical intern, you can face this kind of scenario in future, right? Okay, number 3. Following statement concerning practical guideline is correct. The guidelines, pediatric guidelines, medical guidelines, those kind of things, right? Adherence to the guideline is cost effective. That's what do you think? Always adherent to the guideline is not cost effective, it is expensive. As you are practicing all the things in the guideline, it will not cost effective, it is expensive, right? B, physicians must follow guideline practical clinical practice guidelines to letter to avoid malpractice lawsuits. What do you think? Physicians must follow. No, it's a guideline. It's not a law or something. It's a guideline. You can get the idea, get the summary of the guideline, and you can do some flexible things according to the scenario, according to the availability of the drugs, according to the availability of the equipment. As you are working in a peripheral hospital, you don't have everything to follow the guidelines, so you can get the guideline as a guide, but you no need must follow that, right? So that's wrong. See, it prevents doctors from being sued for giving the wrong treatment. It prevent. If you done something wrong, you can't say this is guideline, what I did according to the guideline, and you can't escape. So it prevent. No, it's not prevent. You can say I follow the guideline. If you give a wrong dose, that's wrong. The guideline says give this drug, but you should know the correct dose and everything. So it does not prevent doctors from giving wrong treatment, right? D, guideline prevent patient from receiving substandard treatment. That's true, right? Guideline prevent, අපි දන්නේ නැති දෙයක් තියෙනවා නම් guideline එක බලලා කරන්න පුළුවන්. So guideline prevent patient be receiving substandard treatment. Yes, that's true. E, only in tertiary care hospital. No, you can practice in whatever the hospital. Guideline, you can go ideally with the guideline. It is expensive, and if you have some alternative options, if you are lack of equipment, if you are non-availability of drugs, you can go for the alternative things in whatever the hospital, not only in tertiary care hospitals, right? So from this, the best answer is guideline prevent patient from receiving substandard treatment, right? So that's the end of our MCQs. So if you have any question, you can ask now. Now I am going to give some summary about our course and what are the things you should learn in related to the forensic in for your ERPM exam. I must say this is not the main subject. You should focus on mainly related to the medicine, surgery, and those subjects. This is a subject. I am not saying that this is not important, but this is a supportive subject. So if you know the legal points and everything, so it will be very easy for you to become a house officer and a doctor. So the ordinary forensic questions, where the let's say 8 to 10 years before, those are sometimes they ask about those questions like after death, rigor mortis occurs in 2 hours, hypostasis will be seen in this area, hypostasis color is this one. Those are some ordinary type of questions where I sat for the selection exam in 2018 and the final MD exam on 2023. So I have an idea about the latest type of questions which are selected by those teachers who are the same teachers who came for the MD exam and the postgraduate exams, who are the same people who are preparing these ERPM exam questions also. So what they are thinking about, they are not asking about those ordinary forensic questions, and they are more deviate towards the practical things, such as let's get an example that will think that you are a surgical intern. So they are going to ask about medical legal things which are related to the surgical intern and your practical practicing the surgery intern period. Let's say what we are going to do is we are going to do those type of questions. Hopefully we can cover 150 to 200 true false and 100 to 150 single best questions and related theory questions, theory part. We'll, let's say the surgical intern. You can imagine you are a surgical intern at a rural area surgical ward, accident service. You are the on-call doctor, and at this time, 9:15, the police can bring a person with wounds and saying that multiple abrasions are there, bleeding from those wounds, and say he's a pedestrian or he's a driver, drunken driver. So what are the things you should know? You have to know the guideline for examination of drunkenness, and what are the tests you can do for the examination of drunkenness. What are the clinical findings? What are the things that mimic alcohol ingestion? A little bit about Motor Traffic Act, and something about the injury categorization of the injuries. So those abrasions and those laceration on the face, under limb, though you have to know about those things. And little bit about excited delirium, and what are the other drugs, heroin, cocaine, methamphetamine, that mean ice. Regarding those things, you have to have an idea about those things as a surgical intern. And let's say the patient is going to about to die. So how can you get the dying declaration? So what is the difference between dying declaration and dying deposition? Okay, let's say the patient develop head injury and diagnose brain death. So how do you diagnose the brain death? What are the tests you are going to do? So after that, let's say the relatives comes and say we can donate the organs. So a little bit about the Transplant Act, and how do you give a death certificate? How do you give the cause of death? What are the things you have to send for an inquest? So how do you how the inquest is going on? So little bit those things we are going to cover in our related to the surgery field, medical legal things. Those are the things. So we will discuss true false questions, single best questions, and the theory part of related to these areas in surgical field. Let's say medical, as a medical intern, you have to know the related pathology regarding myocardial infarction, pneumonia, cirrhosis, and those things, the poisoning. So what are the things, how do you give a death certificate in medical wards? What are the things you should send for inquest? How do you do a pathological autopsy to find out the spread of the disease? So those things are the things which related poison case. How do you inform the police? And let's say you get a patient with unconscious patient to the emergency department. So without consent, are you going to proceed any intervention? So the consent, medical ethics things, the consent and those areas we are going to cover under the subtopic of medicine. And let's say genomes, the maternal deaths, causes for maternal deaths. and the abortion law of the Sri Lanka, amniotic fluid embolism. How do you find amniotic fluid embolism? What are the clinical features? Those things. So we are going to discuss about those things in our questions and the theory course also. And let's say pediatrics. In pediatric wards, there's a patient come from let's say a minor 11 years old child brought from a school to your pediatric ward. So how do you get the consent? What is the legal rationale of getting consent? What is gillic competence? That means mature minor. If there's a child with snake bite, no guardian, no parents, so are you going to proceed without the consent, or are you waiting for the consent? Those are the areas we are going to cover under pediatrics, and also child abuse. How the injury is present, how the management, what are the guidelines? There's a guideline for child abuse management. It has institutional case conference, clinical case conference, how HO can help for the clinical case conference. Those areas, those questions, those true false questions, single best questions, and the theory part will be covered. So basically what I am planning to do with Sudhira, that related to these main 4 topics: surgical, medicine, genetics, and ped. The legal part will be covered with these MCQs and the theory part, rather than going behind ordinary forensic things, such as those hypostasis and putrefaction, mummification, how the Sherlock Holmes uh, goes and do his job, those things. I don't think that they will go and ask those questions. These are the modern type of questions and modern type of topics. These professors who are going to make those questions will more concentrate towards these topics rather than ordinary forensic topics. Anyway, you will learn something, and you can be a good intern, you can be a good doctor one day by getting this knowledge, actually. Right. So that's what we are going to do. Hopefully we can start our course from next week onwards. Sudhira will inform that. So we are hopefully planning to finish, cover 200 true false questions and 150 to 150 single best questions, including the theory parts, which I mentioned a little bit earlier, related to the main 4 subjects: surgical, medicine, genetics, and ped. I am not going to do those ordinary forensic things. I don't think that they have enough time to ask those type of things inside your common MCQ paper and the OSCE paper. These are the more important things, which are more, you should more concentrate towards those things as supportive subject for your main 4 subjects. Okay. Any questions? Sudhir?
Hello, sir. I think that's it. That sums up everything.
Yeah.
Apart from that, so um, the main objective is to cover up the forensic as soon as possible with the little time period,
Yes.
and give all the relevant guidelines and the necessary guidance to pass the new syllabus part 3 paper,
Yes.
as well as the old syllabus part D forensic paper.
Yes.
So we will be commencing the class from next week Wednesday onwards, and probably we will be informing all the times, and all the lectures will be available in platform, as well as you can access them live. So if there's anything, so to mention something, so Dr. Janaka Apollonola, he's acting consultant in forensic medicine. He's currently attached to the Health Ministry of Health in Sri Lanka, and he is one of the leading uh, for JMO consultant JMO, and he is quite capable of, and he's dealing with MD Part One exams as well as the undergraduate exams in the local graduates. So so I hope you all have gained something from these free sessions. And from next week onwards, we are starting the paid versions. So there are two sessions will be available. One thing is MCQ and theory, which is for both new syllabus as well as the old syllabus candidates, and the SBA program, which we will be conducting nearing the exam, because still SLMC has not mentioned about anything about the exams and the changes. So we will be mentioning in that as well as we go on. So we are starting with MCQs, and covering up the theory as well. And then once the SLMC has announced about the SBA and these new changes, so the SBA program also will be starting along with that. So thank you very much. If you have any problem queries regarding the course or any subject material or any subject matter, you can contact me or Dr. Janaka. Um, so is there anything else? So with that, we will conclude today's session. Thank you very much for joining.